the disparity between what I was seeing at work and what was happening on the news. And because you get home, you watch the news at night, and there's Dr. Bonnie Henry, you know, saying it's the end of the world and our emergency departments are overrun and it's just crazy. And then, but the reality in the emergency is the emergency's empty. So Kelowna General Hospital, we lived like between 115 and 135% capacity. That's where the norm was, right? And during this massive global pandemic, they had dropped it down to 65%. They'd stopped doing a lot of the surgeries that were scheduled, right, to make room for the massive influx of patients, and we just weren't seeing them. I was a casual employee at the time, and I had troubles picking up shifts because there was no work. And then I'd go in there and get a shift, and everyone's just sitting around. We have no patients. The patients that come in are completely terrified. The amount of people that are just crying in triage, so scared that they were in the hospital, and just like telling them, hey, don't worry, it's all good. There's no COVID here. And also seeing people coming in that died right away, right? Rather than coming in because they've got chest pain, they sat on their couch and had a massive heart attack over the past 4 days. So by the time that they would come in to the emergency department, they're basically in end stage cardiogenic shock and would die. It was really hard to see, and then just have the backlash and people treat you like a bad person for talking out against it, right? You want to do a good job for people, right? And when a patient comes in and it's just like, oh, they've got the diagnosis of COVID, and it's like, go home and come back if you have troubles breathing, right? And we send them with pulse oxes, and there's just like, there was no real incentive to treat anyone until they got really, really bad. And it's just like, we've got known therapeutics out there, but we're not allowed to talk about that, which makes sense, right? Because they're promoting these experimental gene therapies, calling them vaccines, but you're not allowed to deploy a vaccine if there are therapeutics available. And it was pretty obvious right away that there was therapeutics available. The Lancet put out that big damning study on hydroxychloroquine, right? That was proven to be an absolute fraud, and then quietly retracted it. So like physicians afterward, they're still quoting that stuff, right? Like it was just the disingenuous presentation of false information, like everywhere, discounting known therapeutics that work, demonizing all these benign drugs that even if they weren't as efficacious as certain people were saying, the way they just come right out and say, oh, these things are super, super dangerous, which they're not, right? And that's the tricky part with this whole thing, right? Because people have always had heart attacks and always will have heart attacks, right? So is it just a coincidence that we're seeing all these people with no cardiac history have cardiac issues, a few weeks after they get their second shot or their first shot? It could be, right? But there's certain trends that you see. So, and this is one thing too, like, because the amount of time, like I said, I've been an emergency nurse for 16 years. So things that I don't hear other people talking about, like bee stings. So anaphylactic bee stings, you get a couple a year, 2 or 3 a year, right? I'm seeing 1 or 2 a shift, right? Where they come in and they're full on anaphylactic. We give them epinephrine, steroids, they rebound, we give them epinephrine again, like full on anaphylactic allergic reactions to bee stings. And it's like, have you ever been allergic to bees before? Like, no. I had one guy, one of the last ones that I took care of, it's just like, have you ever been stung by a bee before? He's like, dude, I'm a friggin' beekeeper. And it's like, well, not no more, you're not, I don't think. And it was interesting, right? Because no one puts that wouldn't be marked down as a vaccine injury, right? But the fact that we're seeing just an incredible amount of these things, and I mentioned it to one of the doctors that I work with. I'm just like, hey man, how long have you been a doctor? He's like, since 2015. All right, I've been doing this for 16 years. I have never seen this amount of anaphylactic bee stings in my life, and they're all double vaxxed. And he kind of made a face, and he's just like, oh, that's funny you mentioned that. I had 3 last shift, right? Like that is a year's worth of anaphylactic bee stings in one shift. And I was seeing it every day. So that's something that stood out for me, but that's never going to be marked down as a vaccine injury, right? So you see like the things that we would see, like people coming in with platelets of 0 and bleeding from their gums and their eyes and GI bleeds and things like that.
Are you a professional?